Every minute spent waiting for discharge is a minute lost for patients and for care teams. Imagine being cleared to go home, only to watch the clock, waiting as paperwork inches through the system. This delay is a frustration known in hospitals everywhere. But what if the solution didn't come down from management, but bubbled up from the people closest to the problem? In one forward-thinking hospital, something remarkable happened. Instead of imposing fixes from above, nurses, ward clerks, pharmacists, and billing staff formed their own improvement team. They didn't just follow orders, they took ownership. Using design thinking, the team mapped every step of the patient's journey from clearance to final exit. The pain points were clear, and together, they began asking new questions. How might we streamline each handoff? Could we prevent bottlenecks before they start? Rather than overhauling everything at once, the team worked in sprints. Each cycle focused on a single, testable improvement. Early on, the pharmacy was notified ahead of time, so medications were ready when patients needed them. Next, a digital checklist replaced stacks of paper, so no step was missed and everyone could track progress. Automated alerts to billing meant no one waited for a signature or a stamp. Results spoke for themselves. Discharge times plummeted. Patients left sooner, happier, and staff felt pride, not just in the outcome, but in the process they shaped together. Ownership grew, and every person involved became a champion of change. Agile isn't just for software teams. It's a powerful force for transformation in hospitals. When motivated individuals take charge of their environment, small changes create lasting impact. Changing healthcare, one empowered team at a time.